back here at Cooper Creek Square eating broken candy canes that Turner got out of the discount bin at Murdoch's. They're still good though, so nothing wrong with that. Chatting with Jen Fanning, talking about Grand County Rural Health Network, healthcare. Before we get back into it, stick around because we're going to be talking with Sam Miller of the Grand Lake Chamber of Commerce. Grand Lake is one of the most beautiful settings that we have up here right on the edge of Grand County, or Rocky Mountain National Park. So talking systems change, kind of the, you got a lot of things going on here.
We do. So not only do we provide access, but we're really working on the systems change level because it takes longer term, healthcare system has to change. And so we're really working with our healthcare professionals locally as well as health and human services, so nonprofits, schools, government entities, to really try to look at how we can make changes that we have impact on locally in our system to improve healthcare, to improve healthcare access, to improve everything.
So you're working with the doctors. I mean, everyone's. I mean, this is a community effort.
It's a huge community effort. Yeah. So we're not exactly. We're really trying to focus on, for example, one of the projects that we did was working with Grand Beginnings and the healthcare providers and the child care providers to implement standardized developmental screenings for kiddos ages 0 to 5. Get them screened developmentally because the earlier you screen them, the better the outcomes are long term, the better the system outcomes, the less money spent at the school districts, the less money spent in healthcare, et cetera. So really creating a full process that we use countywide that is now actually being looked at not only statewide but nationally.
So you mentioned, we talked about we got 14,000 people in our county. I mean, that's a lot less than most, a lot of cities, small cities have in their urban population, and we're rural. Obviously, we have a great helicopter system to get you down to Denver if you do need that open heart surgery immediately. What are some other challenges that we face up here
That's a great question. I'd say the geography is definitely an ongoing issue. Transportation. We all know transportation is an issue in our community. There's a lot of people that don't have cars, that can't afford the gas. I hear from employers all the time, it's hard getting people to come to work and be there on time. And it's not because they're not reliable, it's because their transportation's not reliable.
And thank goodness it's not for the entire county yet, but our end of the east side of the county here, we just got the bus system passed, which is going to run from, I think, 8 a.m. till 2 a.m. every day for the rest of the year round. So it's now, thank goodness, we'll have options for people to get around.
Absolutely, it's a huge start.
So it's a start, right? As it doesn't solve that problem. But
absolutely.
Very good. Well, some other things that are, I think, open enrollment just ended this past week. With the health insurance. And so was it December 15th? Is that open enrollment deadline?
Yeah, actually good news is December 15th. So Colorado Health Op has been in the news quite a lot recently and closed, or is not closed, but is not open to sell insurances in 2016. And so because of that, anybody who has currently a Colorado Health Op plan is able, the open enrollment period was extended.
And Colorado Health Op was our state-sponsored.
Correct. Our state, it was a health insurance company created by the state it was a nonprofit, but for Obamacare, for Connect for Health Colorado, and to move forward that. So,
so you just mentioned Obamacare. I mean, are you thinking, what's going on with Obamacare? I know we got half of the government against it, half of it for it.
To be determined.
Why TBD?
I think it's been passed the Supreme Court, I think now 3 times as law, various components of that. So it's in there. And I know, with the presidential candidates running around talking about what they're going to do once they get in office. It's not just about them. Unfortunately, right, that there's other people making the laws and upholding the laws.
They can talk tough, but they got to have a lot of people behind them.
Right, exactly. So I think the hardest thing is the name, Affordable Care Act. It's not really affordable.
Right.
We know that. It's proven again and again not to be really affordable. The tax credits have done a really good job for people who can qualify for them, but if you hit 400% of federal poverty, if you make just $3 more, you don't qualify for those tax credits, and the cost just skyrocket. It's insane. It's so expensive, and we're one of the most expensive regions in the whole country. So, I think.
Do you know what attributes to that? Like why?
Sure. Actually, I sit on the DORA, the Department of
You say
Regulatory
regions. You're not talking
Relations.
Denver, or are you too? Are you talking?
No, I'm not
just
talking
the
Denver. I'm
rural
talking
mountain.
the rural mountain community. So it's basically the entire Northwest and I-70 corridor. We've all been lumped in together.
And that would include like Breckenridge and Vail and all that. I mean, that's
Right.
the corridor we're talking about.
So I just recently had an opportunity to ask the Commissioner of Insurance that very same question when the rates came out, and our rates jumped 28.5%, and everybody else's were 10%. Boulder's actually went down. Like, why is it that ours are so expensive? Well, there's I've seen the algorithm. It makes my head hurt. I'll just say that. There's a lot of things that go into what the rates are, but it's our population is very, very small. Our healthcare is slightly more expensive because we have less of it. Mm-hmm. We have higher injuries like ankle, hip, shoulder, knees, etc. that cost
doing
more
some
long
physical
term.
activities and right, yeah.
And we have higher rates of skin cancer that have less, both of those things have less mortality rates or morbidity rates, excuse me.
I've just got to notice we're going to take a break before we come back and
Okay.
chat with you for one more spot there. But you heard it from Jen Fanning of the Grand County Rural Health Network. Wear sunscreen. That's
Yes.
how we're going to sum up everything we just discussed.
Good one.
What's the website for Grand County Rural Health?
www.gcruralhealth.com.
All right, Jen. Well, thanks again for being here. We're going to be back and chat with Jen a little more here in one moment. Coop Creek Square. Stay tuned.
Oh my God!